Hi, good evening. How is everybody? Canelli, how are you? It's very nice to see your smile and your beautiful face. And I'm still really inspired and energized by the month of menopause because I think it's just, it's really about time that everybody talks about this challenging, changing phase in a woman's life. And I'm really grateful for these kind of awareness activities that happen all over the world. So, in the process of the menopause and our trainings, and we spoke about the perimenopause and we spoke of the menopause, you all know that I'm a really very big promoter of speaking about things with a name on it. So, I don't really think there's any point of, how do you say, bushing around the bush? No, how do you say it?
Yeah,
um uh, let just we need to say things and to face things the way they come along. There's no point of being polite and being you know shy or really not addressing what we are. And what I see really for years and years in my office is really this whole complex of the genitourinary syndrome of menopause. So whatever that means for everybody. It has a lot of dresses, this syndrome. It comes in all colors and shapes, and it's something that for some reason we still, women as women, think that we should be embarrassed about it and that we, should better not share that with our girlfriend, or we should not really discuss it in all details. And I must say I'm always shocked when I see friends, women that I know that they're friends, they call each other's friends and they're hanging out, they go together on holidays and they do so many things together and they don't talk about it. And I think this is something that we need to change. And that is something that these webinars and these little sessions that we do hopefully helps you to change it and really feel a little bit more comfortable and confident to talk about it. Because, as we all age, one way or the other, we can see, the cheeks falling with gravity, and you see lines, and you have these little lines on your mouth and on your upper lip. And I'm refusing to inject my lips with, with anything, not to get the little fish look. But as we age in our body, so does the vagina. And, just because we don't see the vagina doesn't mean that we don't need to look after the vagina. So I think that is a very, very, very important concept that, it's an organ that is kind of private. We only see it in context with intercourse or surgeries or births or this kind of, um, context. But it is an organ that is very important, has to do with our female confidence, has to do with our female well-being, with our femininity, with our, ability to be part of a, relationship, whatever, if whatever that means. I saw, by the way, the other day a woman that she said she's with a trans man. So, these kind of sexual encounters, they have so many varieties now and so many prefixes and forenames, and so it's really something that we should really cherish this part of our vagina and cherish this part of our body, which is called vagina, which is called clitoris, which is called labia, which is called introitus, the entrance. A lot of women really are also much more aware now because we live in an episode, in a time of this life without hair. We live in the epoch of depilation, so nobody has hair anymore in the sensitive areas. So which means that we're also so much more aware of how we look down there. You cannot imagine the amount of women that are approaching me for labioplasty, for repair of the labia, of the big labia, the small labia. They don't like the opening of their vagina. They don't like the entrance. So they don't like how it looks. They don't like how it's, open. So there's a lot of work going on down there. And so also the aesthetic gynecology, this part of our profession that is really to do with helping women to have a vagina that they feel confident and happy with is an important one. And I really feel that every woman should be confident and should reach out and ask advice, and with great pleasure come to women's care, and we will assist and we will advise and we will guide you. It's funny sometimes young girls that they obviously they're more used to watch pornography. You know they don't really know how a natural labia looks like or a natural vagina looks like, because they've seen it so many times on other medias as being, operated and changed. So when they look at themselves, they really think, oh my God, there's something abnormal. And so they come in disguise, and they don't want to be seen, and they want to, show me their vaginal parts to advise if there's something wrong with them. So, it's really gone the other end. And I think we should be confident, and we should be really able to ask for whatever crosses our mind, and get the solid advice that is safe, and the solid advice that is also not too extreme, and move on. And the vagina in the menopause is really something that is like very much aging as well, and especially in the perimenopause, where the hormones go up and down and there's no continuity, and sometimes the levels are very high and sometimes they're very very low. There's more discharge, there's less feeling of resistance and intercourse, so you feel much less. You don't really have so much the effect of the arousal and of the build up for an orgasm. There are a lot of women that they cannot have orgasms vaginally, I would say almost the majority. And if then you shift the menopause, the vaginal atrophy and the lack of the estrogen, the drop of estrogen and the low levels of hormones really will then result in a slowly, thinning of the vaginal soft tissue and losing the elasticity, being dry. And that has a whole range of symptoms as a result, which are very, very uncomfortable and can be very painful. And they can result in pain with intercourse, but not only that, but they can also result in, you know, cervicitis, or itching, stinging, burning. Very many women have like huge problems with the urinary tract infections after intercourse. So, the intercourse is painful. There's a small traumatizing of the tissues with penetration, and then, you get the UTI 24 hours later, which can really destroy any desire for sex and any interest in sex, because if you know that every time you have sex, you have then a bladder infection, and you go through the rigor and the fever and the pain and the frequency and the stinging and the burning, it's really something that is, extremely uncomfortable. And it really destroys this whole concept of wanting to do sex with your partner. So my point here is that the vaginal atrophy and the vaginal decline of elasticity and all of that is really something that can be dealt with. It can be done. We can use vaginal suppositories with hyaluronic acid. We can use vaginal suppositories with boric acid. We can use probiotics, prebiotics. If the vaginal atrophy is advanced, I would always advise local estriol, which is one part of the estrogens, a little bit of testosterone. Very often, I also give DHEA as a suppository, which is a precursor of the testosterone. So, like we put our face cream at night when we brushed our teeth and we go to sleep, and we would always, apply some creams or at least wash the face and etc. The same applies really to the vagina. So we do need to look after it. We need to insert certain suppositories on a regular basis and not only when you're in pain or you're in discomfort. So make the vagina part of your little routine. Doesn't need to be every day. You don't need to wash the vagina. So because too much washing would then really destroy the pH and the microbiome in the vagina that we have as we have it in the gut would then be destroyed if it's washed too much. If there's discomfort or some too much discharge, I would usually recommend a vaginal douche with baking soda or with calendula, vama, like tincture or something, so that you can actually get rid of the pathogen. But it's really something that can be very miserable for your life and for your relationship also, because then the partner feels rejected and really thinks, oh, she never wants to be with me, and she doesn't like me anymore, and all of that. And there are these consequences in a relationship when you don't feel comfortable and you're in pain and in discomfort. So speak out, go really and try and find a solution with your healthcare provider. Come to us. Very, very happily we'll look after this very complex topic. And because the vagina and the bladder, they're basically neighbors, and um, they share a very narrow place, narrow space, which is really it's the bottom of the bladder and the top of the vagina. So it's very related and can really cause a lot of discomfort doing something in the vagina and have as a result a UTI. One thing that I use a lot is the FemiLift. That is a vaginal rejuvenation laser, which in a way resurfaces the soft tissue, and with the CO2, the small microscopic injury, it encourages the soft tissue to self-generate and to rejuvenate, which is really very amazing results. So you can actually see on the epithelium, which is the blue slide, that that the thickness of the mucosa of the vaginal tissue is really very much increased. So your elasticity really increases a lot. So that's a very beautiful technique. Lasts about 10 minutes, gets inserted in the office. There's no downtime. And you usually need to do 3 sessions in order to reapply the laser and make sure that it resurfaces the mucosa of the vagina. Another thing is a chair that is called Emsella, that you actually sit on, and through the magnetic field of that chair, you get increased blood supply in the perineum and in the vagina, so that that really also whatever you insert gets absorbed so much better, and it has zero pain. So you just sit on that chair with your clothes on. You don't need to undress. You're not exposed in any way, and you just sit on it. One session is around 29 minutes, I think 28 minutes. And through this magnetic field stimulation through your pelvic floor, it really enhances very much um, the blood circulation in the vaginal area, and the pelvic floor. It also works for incontinence, for this really very difficult moment that you cannot hold your urine and you really need to run or you pee on yourself. It's also something that is a lot happening to a lot of women. So there are a lot of there are a lot of things available now that are really helpful. But I would say extremely important is also not to smoke. Of course, when you have something unfortunate like chemotherapy, or you need to take any kind of hormone therapy for breast cancer, which is an anti-estrogen, that really also affects very much your vagina. So because there you cannot give any hormones, I would very much recommend the Emcella or the Femilift, and really look after your vagina. I mean, this is really the most important thing. Don't wait for it to go down, but really make sure that you have a very good routine there with your vagina, looking after it.
Another question we often get is what, women are asking what to put on with dryness. What can they use, or what can they use during intercourse to assist with this, with the dryness and the pain and this, uncomfortable sensitivity?
I mean, there are some lubricants that they're available in the pharmacy. There's lubricant from KY gel. There's a lubricant which has a bit of chamomile. So you apply it, especially at the entrance of the vagina, and a little deeper. You can use coconut oil, which I also like. It's a little bit more smooth and very, very helpful. But if you want to really get out of this habit of having to use a lubricant, which is also a little bit anti-sexy, I would say, it doesn't really, give the whole getting together a very creative taste. It's very practical. You start putting all these creams and stuff. I would really suggest to look after the vagina on a regular basis. Just have 3 times a week. Insert, a hyaluronic acid, a probiotic, if indicated, estrogen with testosterone, maybe some DHEA suppositories, so that you really that you have a level of moisturization, that you then are not in the position to really have to use the lubricants. But I would always use a lubricant that is kind of approved for vaginal use. I wouldn't just use a face cream for the vagina. So it needs to be, the only thing that I've really seen that really works, which is not specifically dedicated, is the coconut oil.
And the importance of understanding the microbiome in the vagina, and because most women haven't made that connection, right? That our gut is actually, the extension of the gut is actually in the vagina.
Yeah, I mean the microbiome, which is basically the layer in our digestive tract, which is a continuation in the vagina, which always has a whole pool of bacteria that they live there in, usually in very great harmony. They have a good amount of good bacteria and of bad bacteria, that there should be in balance. And if this microbiome gets disturbed because you're smoking, or you're eating only crap food, you only have processed food and takeaways and lots of sweets, and no real fruits and vegetables, and good sources of protein, then your microbiome gets reduced to the bad bacteria. And very often, the discomfort of itching, burning, stinging, comes with no obvious reason. And it's always problematic, because you always think your partner gives you this bacterias. And in my experience, most of the time it's actually generated through the imbalance in the microbiome. So the microbiome is very, very important. There are now some probiotics that they are really designed in such a way that they also act on the vagina, which is really very good. This is a new technology, and I usually suggest probiotics and prebiotics alternating, and really be very conscious, with your food. I mean, I would say that the majority of patients, if you change their food and their eating habits, most of the symptoms go. And alcohol and a lot of processed food and sweets and too much white flour, etc., is definitely destructive for the microbiome. And then here you go. Here comes your E. coli and your bacteria that comes again and again. And the classical approach would be that you then take one antibiotic after the other, but of course it cannot go because you self-generate it. So that's why the microbiome is a very important step, to assess it. We can actually do a specific swab for the microbiome, which is called femoscan. So it's not just the culture of the pathogens, of the pathological bacteria, but it really looks at the whole array of good and bad bacteria. What is the degree of inflammation? How good is your milk bacteria? Your lactobacillus. That is very important for the balance in the vagina. So we have seen even in studies that a poor microbiome in the vagina will will not allow for the woman to get pregnant. So the poor microbiome is something that has much more consequences than just itching or burning. But if we're talking about the genital urinary syndrome of the menopause, definitely the atrophy makes the vagina much, much more susceptible and prone to infections and to irritations.
I find it fascinating, and by looking after your microbiome and how it can assist with the elasticity, in the and actually, it's so interesting. Even if you take a lady that, let's say she's drinking her alcohol, she's having her desserts every night, and then you just get her the next day to start the day, some lemon water and some fruit, and then, chop up a lot of like fruits and like vegetables and make a nice guacamole. It is so and then just by her going through that, the moment a few hours on the palate, you will stop craving the sweet and the alcohol, just because she's choosing better vegetables. And even after she decides to have that, if she wants to have some majuya dates, and still, tell the taste buds, here's the sweet that you're craving, but not giving the addictive food. And all of these plant fibers, what they do is they actually go straight into the gut and they start building the microbiome. I mean, the microbiome is just the most wonderful. It immediately goes to work the moment you give it the good things, the plant fibers. It needs plant fibers, and then it clears up and your estrogen receptors start doing their job. And I mean, it's like watering a plant. If we gave the plant Coca-Cola, it's not really going to be thriving. But the moment we give it water and sunshine, and immediately, like immediately. The same with the microbiome. I always find that so fascinating. And I love what you just said there, Dr. Sabine, is that, the atrophy can also be assisted so much by just feeding, which we don't make that connection, right?
And the atrophy is also nobody's fault. Let me also put this, pointed out. We have achieved this amazing longevity, and we're just so much longer around and sexually active, and hopefully in good shape, that obviously the vagina, when it ages, you are still active with it. So, and the atrophy really happens from the decline, if it's not chemotherapy or some anti-hormone therapy because you have cancer. The atrophy is a natural result of the decline of the hormones when you go into the menopause. So it's a natural process, but we don't need to really live the consequences to that degree, because we can just even do a local hormone replacement therapy in the vagina, and revive the vagina and make it really as youthful and as usable. I always say, as you can be visited again, you can have visitors in your vagina without, falling apart and being, terrified about the consequences and the pain and the everything. So, but the most important thing here, Canelli, is really diagnose it, address it, and deal with it. There's no shame about it.
And the beautiful thing, the other thing that we were discussing earlier is also, have your vagina go to the gym regularly, whether it's with vaginal exercises or to consistently stay having your
Active and
sexual
moving.
activity, activity. So often women, don't feel like it, right? Let's address that. Let's talk about, well, they don't feel like having sex, right? Often people say, just have the sex and then feel like it afterwards,
Yeah, but that's how it is, and I always say, at a certain age, you should not wait for the urge that the body is asking for it, but you should just make it a point that you do it anyway, because you want to be close with your partner, you want to share, intimacy, and all of that is very important. And then, the endorphins and the orgasm that comes is just so rejuvenating. So just see it as a therapy plan. You tr- You're doing anti-aging if you have sex. So you give the exercise to your vagina, and you also, benefit from the effect of the dopamine and of the oxytocin, of, all these nice hormones that get secreted. And it brings you closer to your partner, I mean, ideally. Anyway, and when we do our hormone harmony program, and women really go through this whole reset of their gut flora, of their liver, of their gym structure, of their sleep pattern, how they feel feminine and not, all of this really also affects the vagina. And women really very often say to us that, all the problems that they used to have there have been eliminated and without doing anything. So please integrate your vagina into your health routine, and see it as a vital part of your body that you need to look after, and it will pay back with a youthful, joyful environment. Correct. Very nice, my dear. So it's important to talk about these things, and to not shy away. And I can tell you, as a gynecologist, being a female, that I hear this all the time. So you're not alone out there. So it's really something that we all suffer to one degree or the other. And don't be embarrassed. This is very important to me. So thank you for your time. Thank you for being here with us tonight. And I'm wishing you all the best, and be well. Thank you, Canelimo. Bye. Bye-bye.